Now, coming to the section of hypopituitarism, which includes the diagnosis. How are we going to diagnose a patient with hypopituitarism? The presenting complaint of the patients with hypopituitarism is usually very subtle, and the clinicians, they usually need a high index of suspicion to reach the diagnosis of hypopituitarism. If there is the symptoms of very different hormones such as hypogonadism, if there are symptoms of hypothyroidism, and if there is symptoms of growth hormone deficiency, so all of these hormonal tests are supposedly done collectively. And if in case there is an insufficiency of one of the hormones of the pituitary gland, it's very necessary that we perform the other test of the hormones of the pituitary gland. So we'll be talking about the list of tests that is done in patients with hypopituitarism. So hormone level testing, like I mentioned before, if there is a single hormone deficiency and there are symptoms, we need to diagnose if there are other hormones that are also involved in case if there's a single hormone involved. To see the underlying etiology of the pituitary gland, if there is any tumor or any other space occupying lesion, it's very necessary to do tests such as the CT scan. An MRI of the pituitary and the hypothalamus region is very necessary to rule out any pituitary adenoma or any space occupying lesion. Angiography is usually done in patients with suspected carotid aneurysm, or in case we need to see the origin of the blood supply of the tumor. And lastly, formal ophthalmic examination is also usually done in patients, such as if they present with symptoms such as bitemporal hemianopia or any color difficulty, seeing in different colors. So a thorough examination of the eye and visual field testing is also very necessary in these patients. So now for evaluating a patient with hypopituitarism, the series of tests includes all the hormones that are involved. For example, the growth hormone is supposed to be tested, and then we test the thyroid function tests, and then we have a list of the tests that are done regarding the LH, FSH, IGF-1, and prolactin, and very importantly, the morning cortisol. So if we talk about the series of hormonal tests, first being the 8 a.m. Plasma cortisol, which usually have a level below the 3 microgram of per deciliter. So this usually cortisol test is done in the morning and around 8 a.m. And if it is below 3 microgram per deciliter, then the patient is labeled as hypocortisolism, and this could also be called as the secondary adrenal insufficiency. So it shows that there is a problem with the hypothalamus, and that doesn't send the signal further to the pituitary gland, and thus the cortisol level is not increased. But if in case the cortisol level is 18 microgram per deciliter or greater, so we could exclude everything else other than the ACTH deficiency. So if we talk about the ACTH reserves and evaluating it, it's usually done with the help of a test that is the insulin hypoglycemia test. So what really happens is that there is a normal cortisol response in an incremental level. So this usually is done to see the ACTH level if it's deficient or not. Next, if we talk about the thyroid hormones, serum thyroid T4 is usually done with the serum TSH concentration. So as you all know that in hypothyroidism, what happens is that the T4 level is decreased and the TSH, thyroid stimulating hormone, is increased. So this causes thyroid dysfunction, which is the hypothyroidism. And then we could also see the normal or the subnormal LH level with low estradiol levels. So what usually happens if we talk about the males, we would see that there is a decrease in the testosterone level, and then there could be a decrease or normal level of the LH hormone, and this is usually indicative of the hypogonadotropic hypogonadism. And if we talk about the females, in the premenopausal woman, it's usually that the level of estrogen is decreased, and this is an indicative of the hypogonadotropic hypogonadism. So this is also known as the secondary hypogonadism that usually occurs in the males and females. And lastly, if we talk about the growth hormone deficiency, this test is usually done with the help of any provocative tests. And ultimately, there could also be an increase in the prolactin level, which is usually in patients with hypogonadism. So if there is a patient who comes up with prolactin level that is increased and he also additionally has hypogonadism, so we could suspect the patient of having pituitary adenoma. So the conditions known to immune the hypopituitarism and to be distinguished from hypopituitarism in cases that we misdiagnose hypopituitarism, these should include patients with anorexia nervosa, any patients having a protein caloric nutrition sort of a diet, and then if the patient has any systemic illnesses, any chronic renal or liver failure, and ultimately liver cirrhosis. So these are the list of diseases that is very necessary to exclude before giving a patient the diagnosis of hypopituitarism. So these were the lists of tests that we usually do on a patient with hypopituitarism. So there are all of the hormonal tests that we do, and then there are a series of tests that we do for finding out the etiological reason of hypopituitarism that includes CT, MRI.